everyone. Dr. Jonathan Schetzsle.
Dr. Boureois.
Today we're bringing you some information and we're talking about Medicare and Medicare caps. Medicare cap is just referring to the number allotted for anybody utilizing Medicare per year, regardless of what happens or what they need. So right now we're sitting at about $2,000. Each person that is using Medicare, they get $2,000 to come see physios, come seek the treatment they need in the physical therapy clinics. This is kind of important because of 2018, our Medicare cap is now a hard cap in which you can no longer petition for more money or more services, regardless of if you're better or if you have something happening later on the year that you might need some treatment for as well. And this all got started with a misreading of the comma, in which now not only is it $2,000 for physical therapy, but that is also included speech therapy, which can really be important for those that have some neurological insult. But our main point today is talking about the Medicare cap. 2018, some firm changes came into law, and how we can change that and what we need to do in order to change that. And Blaze is going to take you through a story, just kind of highlighting the needs and the differences that you might encounter with people on Medicare.
Right, so what I have is an example of why it's so important to repeal that cap. And what I did was I had 3 patients who all started with therapy last year at about the same time. They were all on Medicare, they were all female, and they all had the same surgery performed. They were rehabbing for lower back surgery, after lower back surgery. So, and they all started about the same time. Well, one of my patients who, and each one of these patients had different things that were most important to them, right? So one patient was just trying to get back to where she can get on the floor and play with her grandchildren. That was most important to her, and that's where her number one goal was. I had another patient who was trying to actually get back to work. She was a babysitter. That's what she did full time. That was her source of income, and that's what she loved doing, and that's what her main goal was to get back to doing. So if I use those 2 for example, one patient, the first patient who was trying to rehab to get back to playing with her grandchildren, she did extremely well, especially early on in therapy, and she was able to rehab and get everything she needed in about 15 or 16 visits. So she was able to get a full rehab from that surgery within the confines of this therapy cap we had. So everything was just fine. She was able to discharge, go home. She knew the exercises she needed to do to continue. She was able to get on the floor and play with her grandchildren for as long as she needed to, as long as she wanted to. So that's a beautiful success story. Where the problem comes is not everybody rehabs that quickly. Everybody's different. Everybody responds to surgery differently. Even though they had the same surgery, this other patient who was rehabbing to get back to work didn't quite go as planned or as quickly as she hoped. And that's just how it happens sometimes. Some people don't heal as quickly. Some people take longer through rehab. I mean, we see it every day. This patient she exhausted her therapy cap to where the only way I could keep seeing her was to ask for more visits, which was possible last year and is no longer possible this year because of that hard cap that Jonathan was just telling you about. So luckily, I was able to keep seeing her past her cap and still progressing her to get back to where she can go to work. If I seen her, if she had her surgery just a little bit later to where I didn't see her until 2018, and I'll be a son of a gun.
Blaze is going to stop that. We'll be right here. Come on, Blaze. We ain't done yet.
So, where were we? So,
she exhausted her cap, but you were still able to get more visits.
If I see her just a little bit later, this year, she exhausted her cap, I basically have to sit down in the clinic, say, you're progressing well, you're still doing well, although slower than some people, she was still progressing well, getting to where she needed to be. But because of that cap, I have to tell her, I'm sorry, unless you're going to pay out of pocket, I can't do anything for you. And that's where it really hits home, is that because of where we're at right now, this patient can't keep doing what she needs to do to get back to work. Even though I can tell her, yes, if I keep seeing you, we will get there, most likely, in my best educated opinion. And that's just where it becomes really difficult.
Sure. Blaze said 3 patients. The other one turned out just fine too.
Absolutely.
We were just picking on 2 for time's
That's
sake.
right.
And then, talking about repealing that cap and really kind of just getting away with that so that we can treat people the way they need to be treated and get them back to whatever it is they need. This is really important for us as young professionals and young physios because soon enough, in a few years, those people utilizing Medicare are going to be our parents. Those are going to be the grandparents to our kids. And they need to be able to access physios as they need to get healthy, stay healthy. And, whether it's getting back to work, taking care of the grandkids, traveling, whatever, they've earned that point in their life of where they're at, and they deserve to get access to the treatment that they need. So hopefully 2018, with some of the things we're putting together and giving to y'all, that we can work together and we can repeal this cap so that both your parents and our grandparents can get the help that they need. Thanks for watching.
Thank you.
Simple.